Hello, I'm Dr. John Kruse, and welcome to today's question and answer hour. So during the hour today, I will try to answer questions on the videos that were released this week on ADHD in general and on other mental health topics that you might have. As usual, the comments I make are here for informational purposes. Hopefully it will be both informative and useful, but they're not specific medication recommendations or treatment recommendations with other modalities. You should always consult your own treatment team to find out what's best for you. But it may be helpful for some of your treatment providers to listen to these videos as well. I also do have some questions left over from the end of last week when we had a bad internet connection, so I will get to them. But I will first summarize the two videos that were released this week, and then we'll move on. I see there's some questions that have come in already. So the two videos this week were, one was lead and ADHD, and two was ADHD and lying. So the lead one was a new recording. So in the mid-70s in the US, the EPA required gasoline manufacturers to start removing lead from gasoline. And at that time in the mid-70s, the median, so that's half of the people were above, half below, and this is children, not people in general. The median blood level was 15 microgram, above 15.15 micrograms per deciliter of blood, of lead. Right now, anything above 3.5 micrograms, so this is close to 4 or 5 times higher than that, is considered not safe. And we know lead is associated with substantially greater risks of ADHD. It's also independently or separately responsible for impulsivity, predilection for violence, and much of the crime wave of the 80s, at least some part of that was attributed to such high lead concentrations in the kids who were born 15 to 20 years earlier. So we have almost certainly prevented millions of ADHD cases in the United States from occurring by reducing lead levels. Now, two things. Even elevated lead levels doesn't mean everyone at that level develops ADHD. So there's probably an interaction between genetics and lead levels. There's also an interaction between lead levels and other cofactors that are probably associated with it, like lower socioeconomic status, maybe different nutrition, maybe different exposure to green spaces. So although lead seems to have some role, lead is interacting with genetics as well. Part of why this is topical is the current administration in the US is trying to promote burning substantially more coal than we've been burning, and at the same time explicitly reducing lots of the environmental restrictions, including not requiring scrubbing as much lead out as possible, and arsenic and other poisons. And of note, in China, which does rely more substantially on coal than the US economy, but in China, it's been clearly documented that lead in smoke emissions from coal burning is the primary contributor to lead poisoning or lead contamination of people in that environment. Why we would want to be replicating that in this country is not clear. Second video released was a re-recording, improving the sound, thanks Max, about ADHD and lying. Now, if you go online, there's some claims that people with ADHD lie much less than the general population because they're candid, they just say what's on top of their mind. There's the other claim that people with ADHD lie much more and they're narcissists, and neither claim has much empirical data. And I think it's important to separate lying into 3 at least distinct categories. This is my breakdown, others break down differently. One I would call simple falsehoods. So those are just statements that aren't true, but someone's not necessarily insisting that this is a truth. They're sort of speaking off the top of their head, shooting from the hip and just blurting something out. Kind of like when Trump mentioned you could get rid of COVID probably by injecting bleach under your skin or exposure to bright lights. He wasn't telling his followers to do that. When he tells people to do something, he gives simple 2-3 word commands: lock her up, shut it down, something like that. But this was different. This was rambling. So one source is untruths that aren't actually intentional lies because no one's expecting them to be believed. That, I think, is more common among many people with ADHD. The second two are both lies in that they are conveying some intention of deceit, but the difference is one set of lies are reflexive, that someone is caught being late to something or something, other social problem, and their automatic response is to defensively say, oh, I didn't do that. Oh, I got stuck in a traffic jam. That's why I was late, X, Y, or Z. And then the third type of lies are premeditated lies where someone is planning ahead to deceive or manipulate others and giving false truths. So I think and I call those reflective lies. Someone reflected about them ahead of time. I think the reflexive lies, automatic responses, at least in some people with ADHD, are more likely than in the general population. That's not everyone with ADHD. I think reflective lies, because many people with ADHD are aware that it's harder for them to keep track of multiple storylines. It's harder for them to not spontaneously blurt out something. So there may be some truth, although again, it's not objectively measured, that people with ADHD are less likely to tell reflective lies. So that's what's left. So I'm going to jump into some questions that were left over at the end of last session. One of them was from DD, who had a question about PRAL, P-R-A-L, or the potential renal acid load, and whether non-stimulants like atomoxetine are a problem with that. This is of concern for people with kidney problems who delivering too much acid to their bodies, or what will be turned into acid within the bodies, could prevent a problem. And I haven't found anything that would document the atomoxetine or most of the other common non-stimulants for ADHD are much of a threat in terms of PRAL, but that's not I can't give a blanket clear statement there. And then there were two questions from Mr. AKA. The first one was that he noticed he has a CO2 carbon dioxide monitor, and at nighttime, he's getting levels that are upwards or around 1,000 milligrams. I'm not remembering the exact unit, 1,000. And wondering whether that was contributing to some cognitive issues maybe associated with ADHD. So 1,000 is at the upper level of what's considered safe, or probably in the range that it may be having short-term impact. Usually it's sedation, but probably there can be an impact on other cognitive functions. And if you're just less alert or more drowsy, that's going to impair executive functions. I haven't found any direct research looking at CO2 levels and ADHD symptoms, but the thought would be most of the the CO2 is building up either because you're breathing a lot or there's some combustion, some furnace that isn't burning cleanly properly, or gas stove. And also that ventilation is probably less than adequate. So usually CO2 isn't building up hugely at nighttime otherwise. And again, most of the cognitive effects are thought to be fairly short-term, although if it's day after day, there does seem to be some cumulative possible effect on the brain. Most of this, at least when it's not dangerously, I mean, if CO2 levels too high, if it's completely a CO2 environment with no oxygen, you will die. We're not anywhere near that in this range, but the general thought is most of those cognitive effects should be transient. So if it's generally at nighttime and you're out of that during the daytime, it's not clear whether or not that may be having some impact during the day. The second comment by Mr. AKA was a discussion that we got into on trying to find doctors that are more sympathetic or more willing to listen. And his either experience or sort of assumption was that younger doctors tend to be more sympathetic. I actually have not seen that. So I know many good psychiatrists that are in my peer groups. I know some good ones that are older. I know some very good ones who are much younger. And I also know incompetent or poor psychiatrists in all those age ranges. But if I were to generalize, my bias is that people who were trained before my time, so I'm in my early 60s, my age and older, medicine in general and psychiatry in particular was seen more of as a calling than as a career or pragmatic money market making entity. And I see many, many young doctors who seem to be more focused on the business aspects of medicine and treat it more as a job than as a calling. And I would expect that to result in people who are less sympathetic and empathetic rather than more so. That's my bias. And that's a generalization. And we should treat people as individuals. You might be aware of some biases ahead of time, but there's always exceptions to all these generalizations. So I see a lot of questions pouring in, and I'm going to have to scroll back up because I saw some good questions at the beginning from D. Boss. So D. Boss is finally on stimulant medications, and he feels that they feel that it's improving their life. They have a better mood and outlook, and they seem to be focusing better. But the therapist recommends doing a dopamine detox instead of taking meds. Is it bad advice? So I'm almost cringing because I don't even know what a dopamine detox means. I mean, I think I know what it's trying to mean. Dopamine is a neurotransmitter. You have it in your brain. You're not going to get rid of all the dopamine. You could get rid of medications that are interacting with your dopamine system. But sort of what's important is the balance of dopamine. And I'm confused as to where they're coming from or what they think a dopamine detox will do if an individual has ADHD. Again, I haven't evaluated this individual. I don't know, but I would. There. So the second part of the question is the stimulant medications helping this individual, but it seems to give a little bit of anxiety at times. But overall, life feels better. And the doctor, which I guess is separate from the therapist, added Intuitive in hopes of improving that anxiety. So that's a reasonable expectation. Again, it may take a few weeks to see if it happens. My general approach, again, this is not a specific recommendation, but my general approach with someone is feeling a little too revved up on stimulants is always to back down on the dose. So rather than push higher or add a drug to account for side effects, my approach is usually to back down on the first drug, because if optimally you can get everything you need from just a lower dose of the first drug, that's probably better than combining two drugs. That's my general approach. So Mark asks, why do I feel more social when I'm tired, but when I sleep more, I feel more productive? So again, and I don't know whether this applies to you, Mark, because I don't know you, but my general explanation or thought would be, for many people, anxiety is a barrier to socialization. We worry what other people will say. We will worry how we come across. That's probably more prominent among people with ADHD or neurodivergent approaches who are treated as they were and do behave somewhat differently. So their actions and speech are more scrutinized. So just like alcohol releases inhibitions, being sleep deprived can also release some inhibitions. So being tired probably helps to censor yourself less, to be more relaxed, to be able to be more social, but it's clearly not helping most executive functions of the brain, so you're not as productive. On the other hand, when you sleep well, then you are more able to be focused on a task. But for you, it might mean that also means when the task is trying to be social, some of your brain is to socialize is focusing on how am I coming across, how well I'm doing at socializing, rather than just being present and socializing. So Dennis asks, if psychosis involves dopamine hyperactivity in the mesolimbic system, then why doesn't it cause euphoria? So a couple aspects here. So one is dopamine, even in the mesolimbic system, even though people describe, oh, I got a hit of dopamine and I feel great. The feeling, so dopamine has more or maps more strongly onto whether a reward is consistent with expectations or exceeds expectations or below expectations. So it's a matching expectations to the actual reward. The actual euphoria is probably more anandamide and oxytocin, probably other chemical systems in the body. So that's part of the answer. The other part of the answer is some individuals, particularly if they're floridly psychotic, can certainly be euphoric. I mean, that's part of the giddiness, part of the, they may be causing misery around them and be extremely bizarre and uncomfortable, but there might be some enjoyable aspect to that they are seeking or experiencing, and they might be contributing to not wanting to be on medications. So I don't know if that answers the question. I hope it does. Thanks, Dennis. Hello again, James Alexander. James Alexander asks, have I ever had ADHD patients who benefited from moving out of their parents' homes, and you have ever helped parents solve FTL syndrome in their children? Failure to leave. So one of the features of ADHD is that it's harder to create the structure an individual needs. That's almost sort of by definition some of the executive function problems. And the right amount of structure, the ideal amount, the positive, when it's both positive and supportive, is ideal, and either too much structure or too little can be detrimental. So if for an individual being in the parental home is either too negative or too stressful or too rigid and feels too authoritative rather than, or sorry, too authoritarian rather than too authoritative, or it could be even too lax. It could be parents not setting any rules or expectations. They're catering to every whim. So yes, I've seen people whose ADHD did better when they moved out of the parental home. I've also seen people who deteriorated because the parents, even if it wasn't entirely positive, were providing lots of structure, regularity with sleep cycles and meal cycles and other things. So I've also seen, in terms of, so I wouldn't overgeneralize. I mean, sometimes it's the optimal situation for parents and for adult children to stay together. I mean, that traditionally has been a fairly common pattern, maybe more so among women than men, but not that uncommon in past generations of humans. I've also again seen either the parents or the kid thrive once they are separate in their separate households. So Dennis is adding a fun fact: before industrial safety standards, hat makers used mercury in their hats, which had led to mercury poisoning and neuropsychiatric symptoms. And this is where the phrase the Mad Hatter originates. Yep. So lead is certainly not the only toxic metal. Many metals are not particularly well absorbed, but particularly organic forms of mercury and lead are, and tend to be neurotoxins, among other things. Part of why lead is a neurotoxin is that so many of our, and general toxin, lead can replace many other minerals, such as copper and iron, that are essential cofactors for many enzymes, and it replaces them physically in the protein enzyme, but renders an inactive form of the enzyme. So it displaces an active form of the enzyme. And if you don't have enzymes if you have enzymes that aren't working, then you're having neuro or chemical systems that aren't working, including some of those in the brain. What else was I going to say? So there is significant evidence that lead contributed to the downfall of the Roman Empire. And although some of the emphasis has been on the upper class, who got poisoned through lead plumbing, who got poisoned through lead goblets and cutler utensils, hard eating equipment. Lead is also in lots of cosmetics. It's part of why lead was put in paint. It makes colors, particularly whites, yellows, reds, more vibrant. It also makes paint dry more quickly. It was also added to certain wines as a flavor and made it sweeter, but then was toxic. So lead probably, particularly the elite classes, had lead poisoning aspects, but there's recent studies looking at the general population. So most of the lead came from silver ores. Many ores of silver, like galena, it's a lead ore. Most of the silver that's mined, the ore contains a tiny, tiny percentage of silver and a substantially higher percentage of lead. So refining it to get the silver is putting lots of lead into the atmosphere, so smelting. And the evidence suggests that across the Roman Empire for a couple centuries until its downfall, lead or silver smelting led to caused increase in blood lead levels of about 4 points, which is enough to cause an IQ deficit of 1, 2, 3 points, and again, more ADD-like behavior. So Max is pointing out that I did have a interview on a podcast called Politico Podcast, and it was released a few days ago, and he includes the link. So the talk was on Trump derangement syndrome. I do have a video on that, and this allowed me to go into more discussion of that term. So I'm losing track on my scrolling. Sorry. Lots of questions today. Thanks. So D-Boss asks, have I seen the study that showed methylphenidate helped PTSD substantially and reduced hyperarousal? How could a sympathetic agent do this? It would seem that stimulants would worsen PTSD. So I am not familiar with this particular study, and I would agree that in general, one of the more useful tools, not actually always, for differentiating complex PTSD from ADHD, which both can affect a lot of prefrontal cortical executive functions circuitry, is treatment with a stimulant, which tends to worsen anxiety and tends to worsen ADHD. Stimulants tend to help ADHD and worsen PTSD. So I know there have been studies showing methylphenidate can help in situations where you wouldn't expect, like bipolar disorder. I'll look up. So I'm not familiar with this study or what dosage range. I mean, it's possible that it was a particularly low dose and it was helping them focus on what was relevant and not focus on irrelevant, distracting and arousing stimuli. I don't have a good explanation beyond that. And I don't know what measure of hyperarousal they were using. So Max, thanks, is forwarding a Reddit question by SM1, and who cites studies stimulants cause brain areas among ADHDers to normalize, but without it being attached to any molecular or mechanism of action. Which stimulants induce brain normalization? So there have been more than 36 studies. Most of them have focused on methylphenidate because in kids, and most of them have focused on kids. Very few were on adults. Methylphenidate, far and away in the US and other countries, is the most common medication for ADHD used. So that doesn't mean it's the most effective at causing brain normalization or changes. It just means what we have the predominant amount of data on. And you're correct that most of those studies are just observational. I mean, one is that very few of them are randomly controlled studies. So they are looking at populations, kids with ADHD who take stimulants or don't take stimulants, and then looking at their brains later on. But often the children are not randomly assigned to the groups. So there could be other statistical factors. However, you would think in general that the kids getting medications tended to be more severely afflicted by their ADHD symptoms. So it's surprising / reassuring that their brains look more, quote, normal by some period in time afterwards. I mean, the hand waving explanation is that if the stimulants are helping your brain behave more like a normal brain, then that's reinforcing specific circuits and strengthening them that are weaker, as it were. And that's what's helping the brain to look more normal, but more specifically, we don't have that. So DBOS is getting back to the issue of the dopamine detox, and the therapist wants to cut out all dopaminergic activities and substances and reset the baseline to get out in nature, socialize, exercise, etc. And so one of my videos is on the myths or the stories we tell about dopamine and norepinephrine. And I mean, to me, there's a kernel of something useful in this idea, but there's so much that doesn't make a lot of sense. They've oversimplified. I mean, one is it's assuming that only bad things, only addictive activities, or only bad drugs are boosting dopamine. But I am pretty sure when I go out in nature, when I identify a bird I haven't seen for a while, or just see a cool osprey swooping down and catching a bass out of the lake, or see a brightly colored redstart flitting through the foliage, I'm getting, quote, a hit of dopamine. I mean, it's activating my reward systems. So one fallacy here is that getting out in nature, socializing, exercising are not activating dopamine. So if the person's saying they don't want you to engage in any activities that activate your dopamine, I mean, if you're not acting your dopamine, you're dead. So I'm maybe pushing to the extreme, but it's taking a simplistic approach that I think is actually not particularly helpful. I'll just leave it at that. Maybe I've beaten that to death, or if I haven't articulated well enough, I can get back to that one. Hello again, Borislav. Would you mind explaining the cognitive deficits that can occur due to a course of painkillers? So, yeah, so one is, we have different classes of painkillers. So one is opioids are the most still widely used painkillers. They tend to be sedating if you take enough of them, but people vary incredibly in their effects on that. More defined specific actions on executive functions, I don't think there's a lot of research on. And there are other drugs like serotonin and norepinephrine dual reuptake inhibitors, like duloxetine Cymbalta, like many of the tricyclics, that probably the norepinephrine reuptake action is improving cognitive functioning or providing some mild stimulus. On the other hand, the tricyclics, but not the pure SNRIs, most of them tend to have antihistamine effects, anticholinergic effects, which can be impairing prefrontal cortical circuits. So I mean, one is painkillers is a pretty broad topic, and I'm not sure that there is that much clear-cut evidence more than generally sedation and addiction pathways. Sorry, I'm jumping around. So Max is forwarding another question from the Reddit subreddit from Substantial Bunch. Could music have any therapeutic value for ADHD? Stimulating parts of the brain, and read that classical increases intelligence and fast music activates the prefrontal cortex. One is, there's a fairly robust body of evidence looking at listening to music while you're doing certain tasks, and most brains are not good at multitasking, and ADHD brains, contrary to most of the common perception, are actually even tend to be worse. Now, on the other hand, if you're listening to music without trying to consciously attend to any of it, that may be different. Yeah, I don't know what more to say. I think the evidence of classical music increasing intelligence is pretty limited. And the measures they were looking at for intelligence were pretty restricted. So whether, I'd say listen to music that you find enjoyable, and if you're trying to really focus on something, unless you have clearly, repeatedly found for yourself that some background music is drowning out other distractions and is useful for you to help focus, then usually trying to have an environment as free of distractions as possible is helpful. Yeah, I'm not aware of, I don't question it, that the research that shows fast music activating the prefrontal cortex, but and then another question from the Reddit from Significant Club, can ADHD be inherited from grandparents? So again, most of what 20, 30 years ago, the hope was we'd find one or two genes that were primarily the big risk factors for causing ADHD, and it would be a dopamine receptor or something else clearly tied to some of the processes we know are generally aberrant or how medications work. What instead we found out is that for most people with ADHD, the genetic component is polygenic, meaning hundreds, if not thousands, of different genes are each contributing a tiny, tiny percent. The heritability of ADHD is fairly high. It's about 0.8, and that's again comparable to the heritability of height. So most people are close to the height of their parents. Given it's polygenic, we would not expect it to be skipping generations. So again, it's not like you need two copies of a recessive trait and you could skip, your parents could be free of it, and then you have one copy from both parents and displaying it. It's not a simple Mendelian genetic issue like that. So yes, it can be inherited from your grandparents, but almost certainly it went through your parents to get there. So James Alexander asks, for your patients who benefited from moving out of the household, what were some of the specific ways they benefited? So one, I've sort of seen two, one is where they felt it was a toxic relationship and lots of argumentation, lots of demands placed on them. And when they moved out, that burden was relieved. I'd say the other thing that makes it hard to separate out is sometimes the leaving the household was also tied with a job or getting a more remunerative job, which made moving out more possible. So it'd be hard to separate out aspects of employment status from aspects of living situation. That's where I would start with that. So Mr. AKA asks, why did God make his tastiest tuna species the highest in lead concentration? So no offense to atheists or vegans, but this question here, probably, lead and mercury and many other toxins, not all, but many of them, including the organophosphates, the PCBs, and many of the plastics, get more and more concentrated the higher up in the food chain you get, whether that also concentrates other chemicals that are part of what we appreciate with the taste. So I don't know how much research has been done on which chemicals or nutrients are the ones that make tunas tastiest, but my guess is that both factors here are tied into being higher up in the food chain and greater concentration of what lower in the food chain are relatively chemicals that are present in small amounts. Ultra Paradoxical has a question. They've always had low blood pressure, but recently discovered that blood pressure seems to be affected by a dose of stimulant. A few hours after taking Vyvanse, it's around 127 to 137. So again, most of our stimulants, guanfacine would be, and non-stimulants, most of our ADHD medications do have some risk for elevating blood pressure. On average, these increases tend to be mild to the point of non-significant. So the group averages usually are in the 3 to 5 points systolic. That's the first bigger number, top number. Just changing from standing up to sitting down or other changes in posture or getting excited often have a much more profound effect on, but transient, short-term effect on blood pressure. But that average increase in blood pressure hides the fact that many individuals have no change, and some group, maybe 15 to 20%, have a substantially 15, 20 point bigger increase. So a substantial minority of people do have blood pressure increases, and for some people it pushes them from being borderline or not previously hypertensive to hypertensive when they're on it. Sometimes just a lower dose of the stimulant helps. Sometimes switching stimulants can help, because even though they all have this general effect for a given individual, it may be different with different agents. And sometimes most of the conventional antidepressants, or most of the conventional antihypertensives, blood pressure medications, can be safely added on if someone needs to control blood pressure or needs a higher dose than they did before. So usually this doesn't seem to interfere with the treatment, although some people do need to stop because of this. Yeah, so 127 over 137 is getting in the range where, if it's sustained at that level, depending on your age and other health factors, if you're 130, 135 for a sustained period of time, that's putting people in the range where doctors are concerned and would consider treatment. So Beth LM has a question about SNRI meds being detrimental sometimes to postural and orthostatic hypertension issues, hypotension. Please explain how atomoxetine could have a negative impact on this. So normally when you change your posture, and this is a really complex plumbing situation that we don't have to be consciously aware of, if you're sitting down, if you're lying down, your heart relative to the rest of your body is in a very different relationship than when you're standing up. Usually our body compensates within seconds to maintain steady blood pressure, particularly blood flow to our head. But orthostatic hypotension, so ortho is stable, so that means blood pressure drops too much when you're standing up after sitting down or changing in posture. And it's well known that an uncommon effect of many medications, including a number of antidepressants, including just SSRIs, can occasionally do it. SNRIs may more frequently do it, but the incidence is pretty low. it's 1 or 2% of people have significant orthostatic hypotension, or sometimes higher. So what's not clear is, why do 90% plus of people don't have that as a side effect? So I don't know enough of the mechanism or know why, again, the same drug should be affecting the same systems, and most people don't have an effect on orthostatic hypotension, but some certainly do. So I don't know if we even know what. So again, it can't just be the drug, because most people aren't having that effect, but some are. So ultra paradoxical, again, I can't make specific medication recommendations. They're one who has some elevation on blood pressure back down to 107 to 112. That 107 to 112 is certainly perfectly normal. But what makes sense, or what is healthy for you? The other thing that's of potential interest, as I've worked with lots of people, I mean, the pervasiveness of health watches and iPhone and phone apps to monitor bodily functions can actually exacerbate many, and particularly given that higher blood pressure, higher heart rate can be triggered by being anxious. And so there are some situations where focusing more on what's going on, or anticipating, oh my God, I took my medicine 2 hours ago, is my heart rate going to be higher? Is my blood pressure going to be higher? It can be the anxiety about it. So for a few hours in the 127 to 137 range, if most of the rest of the day it's not that high, in general, doesn't sound like, it's certainly not a crisis level. So two different issues with blood pressure. If blood pressure spikes really, really high, and really high is above 180, closer to 200 for systolic, that can cause acute damage. That can cause rupture of blood vessels. It can cause headaches. Might be a risk factor for strokes. On the other hand, elevated hypertension is called the silent killer, because it's not having acute effects. It's not that it's horrible that your blood pressure right now is 145. It's that over time, if it's sustained at that level, that causes damage to the lining of the blood cell vessels, and changes in how elastic or flexible they are, which are having impact on all the tissues that have lots of blood vessels in them, like eyes and kidneys and penis and brains. So there's a difference between acute, really dangerous levels, and prolonged, milder levels. So again, it's part of the risk or concern is, how many hours a day is this elevated? And it may be enough to warrant trying a different dosage, trying a different medication to see if that had the same effect or not. Or it might warrant, if the medication's working really well, adding on an agent like guanfacine, which may help with both the ADHD and with the blood pressure. Anthony Howell, hello. You've made clear some of the maladaptive characteristics of ADHD, but can you share any potential benefits of having ADHD, if any? So I do think I have a talk on video on this, on the positive aspects of ADHD. I know some people promote ADHD as a superpower. I cringe a little bit about that, because so part of what I'd say, I do believe it is aligned with neurodivergence, but that means that in the society we have and that exists, that it's causing problems at least some percentage of the time. So in terms of positive things that have been associated with, one is creativity, or thinking outside the box, or non-traditional or non-linear thinking. I think our society and individuals themselves can clearly benefit from not thinking like everyone else does. Two, many but not all individuals with ADHD, it conveys a sense of higher energy, at least in the moment, and many times people around them perceive that person as high energy when they themselves may feel more tired than usual, or that they collapse as soon as they're not in a stimulating situation. But that energy and enthusiasm can be a powerful asset. Getting back to what I was answering earlier about truthfulness. So one is, we see it in certain politicians right now, that speaking your mind rather than carefully considering what you are saying can be mistake. Candor can be interpreted as honesty, and candor itself can be appreciated. This person is telling it like they feel or believe or see, rather than couching or trying to hide what they're really thinking. On the other hand, again, I think there's way too much blurring of candor with honesty. Being candid, just telling us what you're thinking at the moment, does not mean you're being honest, which means whether you're saying something that is true or not. But candor is a positive asset. The second related positive is whether some people with ADHD learn certain strategies that can be effective. So some people with ADHD develop OCD-ish strategies that are, there may be some likelihood for OCD separate from adaptive strategies, but some people very consciously adapt strategies, either regarding punctuality or error checking or other things, which can be helpful to them in their, what else can I say? I'd say the ability to hyper focus, some people can turn into a power or an advantage if it allows them to explore more deeply or more thoroughly, even though they're shutting out the outside world. And there's probably particularly some world-class athletes like Michael Phelps in swimming, and certainly some others whose ability to hyper focus, to get fully embedded in the moment and focus just on that endeavor to the exclusion of everything else, has been helpful. So I'm missing a question. All right. So Max provided the link for the video on dopamine. Wow, I'm gotten way behind on questions. So James Alexander says on the internet, there's something called intrusive sleep is a feature of ADHD. And they're defining intrusive sleep as a sudden and overwhelming feeling of drowsiness that affects some people with ADHD. It occurs when we become disinterested or bored with a task or situation, and especially dangerous if it occurs while driving or operating machinery. And this individual frequently has to pull over on road trips, even after as little as 30 minutes of driving, because I start to nod off. So I often go back to Frank, who's the name I used for the first ADHD patient, and he would chronically, he would come into the sessions, he would talk nonstop, he'd be very energetic, he would often get up and pace around and gesticulate, and he looked extremely present and high energy. And yet one of his most common complaints was how tired, how fatigued he was. And when I would explore this discrepancy between what I was seeing in the moment, he would say, as soon as he got home, he would just collapse in his room and sort of not do anything for hours. So I think one is that probably maybe taking more circuitry to complete certain tasks. The brain is a major consumer of glucose. So I think there's actually a real physiologic fatigue component to this. There may also be an attentional control aspect to this. So I don't call it, so the framing is on intrusive sleep, and that some of the articles I've seen sort of suggest that this almost like narcolepsy, that sleep, so narcolepsy by definition is intrusive sleep, that it comes up in the midst of things. It can come up when someone is excited or overstimulated. And in fact, there's some of the early research done at Stanford was done on certain breeds of dogs, including Dobermans, and it's really dramatic. You see the dog acting normally and then sees its master or someone else and gets excited and then suddenly collapses, loses all motor tone. So I would try to reserve the use of the term intrusive sleep for intruding in the midst of things. Whereas with ADHD, I see it more often as someone is shifted after a period of high intensity focus or attention or activity, then they switch abruptly to a period of fatigue. That's what I would say. So Max, thanks, supplied the link to the video on, I think what I call the stories or myths we tell about dopamine and norepinephrine. So Dropneck says, patients on stimulants which increase urination frequency, should they drink more water to combat that? I had a revelation these days because I have been peeing 3 times an hour every day. So the thought is that certain particularly stimulants that affect norepinephrine, the sphincters to the bladder are controlled by norepinephrine. So it can cause a sense of urgency that you need to urinate when your bladder isn't really full. It can also cause hesitancy. So it can make it harder to initiate a stream of urine flow. It can also make it harder to shut it off firmly at the end or empty it fully. So it can cause dribbling, all these. One is that some people's bodies adapt to these effects of norepinephrine while preserving the benefits for ADHD in the brain. 2 is that I think if you can get your body, so too many times there are multiple drugs that are used to help tell the bladder itself and tell the sphincter at the head of the bladder what's really going on and how to reinterpret what's going on with the body in terms of how full the bladder is and whether it needs to be emptied. My own experience with some patients, and I'd say even personally, is that cyclic sighing is one of the most effective tools. So cyclic sighing is a breathing technique. It's quick, full inhalation to the nose, long, prolonged exhalation to the mouth. And I have bad allergies right now, so I'll make disgusting noises so I won't. Within 2 or 3 breaths, that usually switches people from a sympathetic drive state to a parasympathetic drive state. And I've seen that someone who really felt they desperately needed to go urinate, but they know they went just 20 minutes ago. That can help your body learn, oh, I did that for a minute and the symptom, the urge to urinate completely went away, and I can sit there for another 20 minutes or 3 hours till I need to go again. So most often it's retraining the body or the brain in terms of how to interpret signals that are coming from the body and that are being misinterpreted or misconstrued as my bladder's full, I need to empty it, when it's not. So Borislav liked my commenting on heavy metals and that lead is in cosmetics as well as other sources. Hello, Mike Poulas. Why is it when I take stimulant Adderall, I feel better and can do actual productive work when I have it with coffee versus raising my Adderall dosage? I tried going from 10 to 15. So why the combination of caffeine and Adderall is better than just going up on Adderall? I don't have a good, caffeine itself is clearly a stimulant. It's not acting directly on dopamine. Its more direct actions are adenosine, but it indirectly has dopamine effects. Why that combination works better for you than just pure Adderall, I don't have a good explanation. But so D-Boss asks, do I believe that alpha-2 agonists, so those are drugs like guanfacine, can boost the efficacy of stimulants, potentially avoiding the need to up the dosage of stimulants and or allowing you to get by with a lower dosage in general. I've seen what I believe, yes, would answer that, or that. So yes, I believe I have worked with patients who guanfacine enabled them to get more benefit from a stable dose of a stimulant, and avoided the need to go up to a higher dose of a stimulant. Borislav asks, he's curious to know how electric autos affect us due to the electromagnetic radiation. And I will just pass on that one because I'm not aware of the physics enough to know how close to a electric car one has to be impacted by any electromagnetic effects of the engine. I'm guessing primarily we're talking about drivers of those vehicles. And given that the pollution effects, including lead, but certainly many other products of combustion of the internal combustion engine, are probably substantially more toxic to the individual and to the society than the electromagnetic effects are. That doesn't mean there aren't electromagnetic effects, but wow. So I'm going to try to race through a little more quickly. So Becca asks, glad you made it live. Hope that I'm answering. James Alexander, could extended release alpha agonists somehow increase your blood pressure while taking them instead of decreasing it? So particularly initially, I think there's a chance some people might have a slight, but it would likely to be slight. I'm not aware of it being a common phenomenon that people notice blood pressure going up, except to the extent starting any new drug, there's a certain sizable population of people who get quite anxious starting a new drug, wondering what effect is this going to have on me. And I've seen a lot of people who attributed, I'm the one who always gets side effects to this medication, and yet their side effects are always symptoms of panic and sympathetic overdrive, regardless of the agent. So to me, it's probably in some of these individuals that more were inducing mild panic, and that's being misinterpreted as direct effects of the drug. So Becca's commenting on DBOS, citing dopamine detox classes and feeling they helped. She went off meds to do acupuncture and everything, but decided to go back on their meds. And so this is where I worked from in some of the older videos from first half of 2022. So we do have a house in Northern California still. It's empty most of the year. Thanks. I'm glad you liked the shirt. It was a Christmas present a few years ago. Most of my other shirts are fraying at the collars and well worn, but I believe in getting the most use you can out of it, as long as my torso is covered. That's about all I'll share right there, but glad you saw it and appreciated. So, and my allergies are worse in this Northern California environment than they've ever been. So James Alexander, does Wellbutrin SR work as an as-needed medication for ADHD in the same way stimulants are often used? So yes, this is one area where I differ from most of the experts. Both the biochemistry and patient experience would suggest most of the benefits of Wellbutrin bupropion, including SR formulation, extended release, for ADHD are immediate effects. And I have many people who have taken it the days they needed it, or take a higher dose on the days they felt they needed that, and saw immediate effects or differential effects, and don't take it when they don't need it. If you're taking it for depression, that's not how you should be taking it. So Juan de Andrade, I do believe I have a talk on ADHD and neuroinflammation, or certainly have, I think, one on autoimmune conditions. So a whole host of brain conditions, including depression, including ADHD, including schizophrenia, are associated with findings of higher rates of neuroinflammation. Many of our drugs that are effective, like guanfacine, like amantadine, seem to be helpful at tamping, like methylene blue, maybe. Many of these drugs, in addition to their direct neurochemical effects, also have some effects on reducing inflammation. There's work by at Yale, Amy Arntzen, I may be butchering last name, Arn begins with an A, that the prefrontal cortex is particularly sensitive to inflammation, and that's probably due to the NMDA glutamate receptors. So that's what I would say there. So Juan is following up later with when he experiences what I think is neuroinflammation, when we're able to dedicate a certain amount of time to academic related activities. I mean, in general, many of our neuroinflammatory processes are slower, occurring over hours or days. So whether what you're acutely feeling when you're concentrating is neuroinflammation or more what Arntzen would say is sort of stress-related processes in the prefrontal cortex, which it's also particularly sensitive to. You're welcome, Ultra Paradoxical. Max provided the link on, or one of the videos I have on cyclic sighing. So helpful for falling back to sleep, helpful for starting sleep, but also helpful for relaxation and resetting the body during the day. So Beth is connective tissue abnormalities, mast cell activation disorders are all linked with ADHD. So Borislav is asking how dangerous is 2 liters of Coca-Cola a day. So, I mean, one is that's a substantial amount of caffeine. And even though particularly many younger people feel impervious to the effects of caffeine, it's likely to have sleep disruptive effects. And the amount of sugar, as you pointed out, is a really big dose. So unless you're really active other ways and burning those sugar calories immediately, it's probably not metabolically good for your body. DBoss asks, what do I think of hyperbaric oxygen therapy? Is there any evidence that it can improve or treat ADHD? The report said it's good for inflammation and would assume neuroinflammation as well. I'm not aware of specific studies in it for ADHD. I know there are people promoting it for ADHD. That might be a topic to see if there is any actual research. Part of what's hard to comment there is I think there are legitimate, mostly research academic centers using it for a variety of brain issues, and there are a number of practitioners who are in it to make money, and they will make claims, and they may genuinely have seen patient A, B, or C respond or appear to respond. So they may be deluding themselves as well, but I think the evidence is very preliminary right now in terms of its benefits. So Max, thanks Max, provided the link to the autoimmune and ADHD video I have. And I'll wrap things up with the questions here. So DBOS, is it true that children respond better to methylphenidate and adults to amphetamine in general? If this is true, why is it the case? Thanks. No, it is absolutely not the case. So it is the case that the general recommendation, so the studies consistently show whether you're a child, whether you're an adult, amphetamine-based stimulants work better than methylphenidate. Methylphenidate is comparable to a whole host of other non-stimulants. That's in terms of just efficacy, diminution, elimination of ADHD symptoms. On the other hand, if you look at side effects, these are drugs that have important side effects, and Adderall and amphetamine-based products have substantially more side effects, particularly in kids. So the pediatric groups, the general ADHD groups, all the US groups that I'm aware of that make recommendations recommend that the standard treatment for children be methylphenidate-based products, not because they're more effective, but because the benefit to cost ratio is better for them than for stimulants. And for adults, the evidence, yes, do some adults still get side effects from amphetamine-based products? Absolutely, but fewer do. So the fact that they tend to have greater efficacy, and that doesn't mean every single individual has greater efficacy, but at a group level, it's fairly robust, fairly consistent, fairly clear. So that's the answer to DBOS. Becca says breath work has helped, but it's about the only thing that really noticed, but stopped doing it. So again, part of the beauty of cyclic sighing is as little as 5 minutes a day has substantial benefits throughout the day in terms of mood and probably parasympathetic tone. And some of it may be breathing in more oxygen, but I think again, with particularly cyclic sighing, it's probably more getting activation of that parasympathetic system. Max is thanking everyone for coming today and reminding that next week I will be back here, same time, same place. And Max is also, thanks again, putting a shout out for the Politico podcast on Trump derangement syndrome. Juan has a question. Are there any strategies in place to implement alongside stimulant, non-stimulant medications, specifically regarding strengthening neuroplasticity to that which ADHD patients have a deficit in? I would just say that there's a whole host of cognitive behavioral approaches that get people to practicing things that are good for their brain or that their brain needs to practice better. And that's working along lines of neuroplasticity. And that many of those are hard to do on your own if you have ADHD specifically, but work well with a therapist, a coach, or a group situation. So the finisher asks, oh, great, Max, thanks for jumping ahead and answering ahead of time. I do have a video on menopause and ADHD. The simplistic answer is there is some evidence, 1 or 2 studies, that hormone replacement therapy can specifically help with ADHD symptoms in postmenopausal or menopausal women. Some evidence that it can help women with pre-existing ADHD that's worsened by menopause, and some that have new onset ADHD-like symptoms related to menopause. So thanks for all of you for showing up today. Thanks for the great questions. I hope I gave satisfactory and coherent answers, and stay healthy, stay happy, and I'll be back next week. Thanks.